Alex, you know, you've put a huge amount of work into this book, a lot of your life's work and a lot of effort in the last 15 months about putting into the book. What do you hope that the reader is going to take away from the book?
Well, one of the main things for me is that I think we face a real challenge in changing such a massive system as a health system. And for many years, I put a lot of my effort and a lot of effort of my colleagues. We thought that the heart of the solution was changing understanding. And so we developed all sorts of material and all sorts of approaches to try and help people see the importance of the things that we've talked about tonight. And I came to the realization after many years of effort that just because you've changed somebody's understanding, it doesn't actually mean that they're going to change their behavior. And that actually, as human beings, we have an inherent inclination to not re-examine our behavior in terms of our changing understanding. And I realized that just changing understanding was going to be insufficient. And so one of the reasons I was so keen to write this book was to actually show the journey of changing understanding, but then the more important journey of changing behavior once I've got that change of understanding. And I felt a textbook wouldn't work. I felt that it had to be done through a real life story. And so that was those characters actually struggling with, even though they could see the answer, how do they get others to understand differently, and how do they get others to change their behavior? So it was that gap between changing understanding and changing behavior that was really the driver of trying to create those characters in the book.
Helen, can I ask another question? Helen said I could only ask one question.
You're a very brave man.
Don't ask more than one. If you wrote the book through the eyes of a chief executive, Linda, who we're all fighting for, why did you pick chief executive? Why did you pick that role to write the book through?
Well, in a way, I think they're the ones that are under the firing squad the most in the health system. They're the ones that, you know, that's where it all stops. That's where all the pressure finally mounts. And I'd seen over my years of working, not just in England, but all over the world in healthcare systems, I'd seen that rock and a hard place I talked about playing out in every meeting, every day, and the chief executives having to make those sort of compromises day in, day out. So one day somebody would come into their office and scream and shout at them that they didn't have enough resources and that they must have more resources. Patients would die if they didn't allow more resources to be given to that particular area. And then 15 minutes later, you know, they'd be sitting in a board meeting and they'd be running a board meeting and somebody would be showing the financial position of the hospital, showing that actually we cannot afford to throw more resources at it. So for me, Linda was the chief executive that I've worked with over many years. She was a culmination of all of those people and the struggle that they have. And it's unfair to expect somebody to play God like that. We have to find a better way. And that was why I thought the CEO was a good person to put as one of the main characters.
Yes, yeah, I'm going to ask one more. I want to ask Helen if I can ask. The other characters in the book, did you base those characters on people that you met through your work in healthcare?
Well, it's a very difficult question, this, because I'd prefer somebody else to ask the question, actually, because if I look across the room, I think you all know the answer to that question, because absolutely the characters are based upon many people that are sitting in this room, and many of the struggles that I've seen you take through your careers in health service. So I did change the names, and I kept most of the foibles and the eccentricities, but yes, it does revolve around many people that I've worked with over many years. But I changed the names to protect the guilty.
And strictly between you and I, is John the Monty Python nerd here?
Actually, John the Monty Python nerd is not here.
All right. Good. Can we, I'll get out of my Maya now, and can we roll around and see whether we get some questions from the floor?
Because his name was Stuart, not John, anyway. Bruno.
Yes, thank you. What were some of the most joyful moments in the journey of writing the book, Alex? For you and for the... Yeah.
Well, for me, one of the greatest pleasures of writing the book was actually when we were sharing some of the early drafts with some of our clients and some of our friends, and seeing their reaction to it, because I'd never written a book before. I had no idea how to write a book, and it was those early moments of, is this going to work? Is this going to be relevant? Are they going to believe in the story and the storyline that's there? And to be absolutely honest, without Stuart's help, it would never have happened. There was no way I'd have got through that part of the story. The most joyful moment, let me tell anyone that wants to write a book, the most joyful moment is the very last full stop.
Are you sure that should have been a full stop, Alex? Semicolon, colon.
Would you like to explain who you are, first of all?
May take some time. If you could pick a group of people or a person to read your book, who would that be? Would it be chief executives of hospitals? Would it be the Secretary of State for Health?
Well, my favourite character in the book is Matt the porter. I don't know how many of you read that part, but Matt the porter is somebody who's worked in a hospital for 25, 30 years. He's seen things come and go every day. He's seen management come and go every day, and he just continues to try and do his very best when all around him just seems utterly chaotic and stupid. Yeah? And Matt is a man who I met when I was working in one of the hospitals one weekend, and I was privileged enough to follow him around for 3 or 4 hours and just see, him talk to me about the stupidity of what he saw going around him. So I wanted to write the book for everyone who works in the NHS, right from the head of any health system, but absolutely, definitely for Matt the porter, so that it could be something that everyone could see if they agreed with. Because at the end of the day, the book's a working hypothesis. It's saying, this is a view. Please read it. Decide whether you think it's valid in your environment or not. If it is, why don't you have a go? The details of how to have a go are in here.
Yeah, so Ben Kellard, Alex, you mentioned that understanding isn't enough to create the sort of shift in these organisations, complex organisations. I was wondering if you could just share from your experience, what are the things or contributing factors that leads to that shift, that tipping point, that not just individually within one's mind, but in the system. Just from your experience, what tends to lead to that?
I think my view on this is really informed by what I was taught by Dr. Goldratt, and that is that the more complex a system appears, and I hope those of you that aren't in healthcare that are here tonight, you can see just how complicated these sort of systems can initially appear, yes? Much bigger and much more complex than many organisations that we see out in the everyday world, yes? And I think the most important thing that I was taught is the more complex the system appears, the greater the size of improvement we should expect. And the answer to the question, why the hell can that be true, is because if it is more complex, it's more likely that it's been broken down into more and more parts. And it's more likely that each of those parts is being managed around an individual way, yes? And as a result, we end up with the difficulties of flow, etc., that we've experienced in the dice game, yes? So my view is the reason why these hospitals appear so difficult is because they appear so complex. But that's the assumption that's wrong. if we're prepared to look at them in terms of flow, and if we're prepared to look at them in terms of patient-centered and clinically led, then it's actually relatively easy for us to identify those few places that are causing the most disruption to the most patients most of the time. And that's the heart of what I was taught by Dr. Goldratt.
Two questions, really. One is a serious one and one probably less so. I want you to...
Can I have the less so first? No.
The less so first is, why on earth did you choose the titles of the chapters? Because being a non-musician, I don't fully understand them. So just tell me your story as to why you chose those. And the more serious one is the clinical leadership. You talked about telling the story through the eyes of the chief executive, which I can understand. But you also made the point in your talk about the necessity for this to be a clinically led endeavour, because it's all about the front line and treating patients. So just give me your sense of the need for the clinical leadership and what that needs to be in the future.
So in terms of the clinical leadership, I mean, in a way it's a very simple answer, because I think it's stupid for us to believe that management can solve these problems on their own. Yeah, they would have to be superhuman to be able to try and manage that seemingly complex system. Yeah? And actually, it doesn't matter how many information systems you surround them with and how much data and all the other stuff that they're given to try and help them do their job. At the end of the day, it is those frontline staff that are able to understand patient flow. Yes? So there's two reasons. First of all, if it's going to be patient-centered, it has to be clinically led. How can it be patient-centered and management-led? It's just ridiculous. So it has to be clinically led. And secondly, they frankly know more about the system. The challenge is, and this is a very, very serious challenge, and one I would like everyone around the world to have a go at, is how are we going to engage and excite every doctor and nurse in this topic of managing the hospital? The second one, well, is the video camera running? Yes, so I have to be careful what I say here. So they weren't the original chapter headings. The original chapter headings were actually some of my favourite songs. And that's what gave me the inspiration for each chapter. But we found out we weren't allowed to call them by the song titles. So actually, if you look into the titles carefully, then you'll see why they're the chapter titles they are. But I'll say no more.
Hello, Claire Harmer. You beautifully set out the dilemma earlier on between financial stability and the need for timely and effective patient care. But you kind of left it tantalisingly hanging there. What's the direction for a solution?
Read the book.
Yes, but...
No, it's a serious answer. Let me try and answer it seriously.
Okay.
It is read the book, because I genuinely believe telling people the answer is unhelpful. I genuinely, deeply believe the only way is if people uncover the answer for themselves. Yes? And most of the book is about trying to provide an odd provocation here and there to help the person come up with the solution for themselves. And I genuinely believe anyone who stands up shouting about answers is going to take things backwards, not forwards.
Hi, my name's Deep, I'm a radiologist. This is a comment more than anything else, and maybe you can add to it, and it goes back to what you just said about getting people to take care of themselves in the first place. Because in my experience, these chips have a life of their own and seem to do things that we don't always predict. For example, if the weather's good outside, lots of people in clinics don't attend. So there's that unpredictability about it all, and where do you stand on that?
I think the unpredictability is everywhere, and it's silly to try and expect it's not going to happen. You know, so a lot of people try and forecast it. In my view, a waste of time. Yeah, a lot of people are saying, "I'll try and reduce the unpredictability." My view is, again, you're not going to have any major impact on that. Yes, so what we have to do is create a system that is flexible enough and that is responsive enough that actually it can cope with that without, as I said, asking staff to just work ridiculous hours when the peaks occur and things like that. And so it's about changing the way we manage the flow to be able to cope with that level of flexibility.
Joey Mege, I'm a gynecologist. Thank you for a very stimulating evening and for a brilliant presentation. In one of your slides, you appeared to criticize performance measures in the NHS globally. And I would just like, if you could please expand on your views on this.
Would you like to come back for 2 days? Because that's how long it would take me to answer this question. But I'll give you my best answer I can. One of my frustrations is when you look at the measure systems, many of the measurement systems are about trying to improve individual parts of the patient journey. Yes? And there's very little measurements that look across the whole journey. You know, I understand why the frustration with people waiting in an emergency department ended up with a target like 95% of all patients should be treated within 4 hours, yes? But at the end of the day, it's measuring a part of the system, yeah? And what we really need to do is get rid of many of those local measurements and replace them with more holistic systems as a whole measures, yes? Because I believe measurements change behavior. And not on their own they don't, but they are an important part of changing behavior, yeah? So removing those local measures is very, very important. In fact, in the book, I try and give as many examples as I can where they are a primary cause of ridiculous behaviors. Yeah? Not by ridiculous people behaving according to the measures. Yeah? So I think, and I was taught by Dr. Goldratt this is one of the things that we have to actually tackle head on. Yes, and do, just like we got rid of so many of those inappropriate improvement initiatives, we have to get rid of the measurement systems.